Arthritis is one of the leading causes of disability worldwide, but unfortunately, it is not very well understood. In the UK alone, 1 in every 6 individuals experiences pain, fatigue, and disability that arthritis can bring. And in the United States, 1 in every 3 individuals suffer from arthritis. Despite its common prevalence, there exist numerous misconceptions about arthritis that are frequently considered as true. It's essential to debunk these misunderstandings in order to promote a clear understanding of arthritis so those who are impacted by it can seek appropriate medical advice. My name is Ubaid and I'm working as a first contact physiotherapist in the NHS, and welcome to our channel Physique. On this channel, we help professionals achieve their career goals and everyone achieve their health goals. Let's start our topic right away. The number one myth is arthritis only affects the elderly. Although arthritis is more common in older adults and it usually develops in the later decades of life, but it's not restricted to old age alone. Arthritis can happen to people of all ages, including younger adults and even children. This brings us to myth number 2, that is cracking your knuckles and other joints causes arthritis. People who crack their knuckles or other joints of the body are frequently warned that it will lead to the development of arthritis, but in reality, there is no scientific evidence that can associate knuckle or other joint cracking with the development of arthritis. When people crack their joints, they feel a release of pressure in their joints and relaxation in the surrounding muscles. And this relaxation can lead to more mobility of the joint and is unlikely to cause arthritis or other joint-related problems. Myth number 3 is arthritis is just the wear and tear of the joints. One of the most damaging myths is that any form of arthritis is just wear and tear of the joints. There are more than 100 types of inflammatory joint diseases that affects the musculoskeletal system. Osteoarthritis is the most common cause of arthritis and will affect half of us by the age of 70. But it's not the inevitable part of aging. Our joints are not like car tires that are destined to wear down and be replaced. In fact, our joints are made up of complex living tissues that our bodies constantly repair and maintain, and osteoarthritis only happens when our bodies are unable to do this effectively. In fact, our joints get stronger the more we use them. So by staying physically active and maintaining a good healthy weight can keep osteoarthritis under control. Myth number 4 is cold and damp weather causes arthritis. Although cold and damp weather can sometimes make the arthritic joints feel worse, but it's definitely not the reason why arthritis starts. Arthritis is primarily the result of genetic and environmental factors. However, although colder climates don't cause arthritis directly, but one explanation could be that colder climates don't have enough sunlight exposure. Not having enough sunlight exposure can lead to low levels of vitamin D in the bones, and they might have a negative effect on our joint health. This leads us to discuss the myth number 5, which is very common but not true at all. That is, exercises make arthritis worse. No doubt, people with arthritis can sometimes find it really difficult to maintain a regular physical activity, but a lack of movement can actually increase their symptoms, which is joint pain and stiffness. In fact, adding a regular physical activity in your daily routine can help with arthritis, because using your joints builds muscle strength and improves blood supply, which in turn can ease the symptoms and keeps the joint in better shape for longer. It is understandable that during a flare-up of pain, doing exercises can be painful. But different activities and levels of intensity will suit different people. For example, cycling and swimming are great exercises to try because they get the body moving without putting extra pressure on painful joints. It's always a good idea to seek medical advice from a healthcare professional if you're unsure about what types of exercises would be good for you, as mild discomfort is okay, but in most cases they shouldn't cause a lot of pain. Myth number 6 is arthritis is just joint pain and it's not serious. While this is true for osteoarthritis, but there are different other types of arthritis like rheumatoid arthritis, which can affect various organs and different systems of the body in addition to joint structures. Therefore, timely and correct diagnosis is of supreme importance. As for some people, these changes could be very debilitating and can reduce their quality of life significantly. Myth number 7 is there is no treatment for arthritis. While arthritic changes cannot be reversed, but there are many effective treatment methods for managing the disease, including pain relief medications, physiotherapy, disease-modifying drugs for inflammatory arthritis, as well as joint replacement surgeries in some cases. It is also recommended that people with arthritis manage their lifestyle effectively and try to lose weight if needed, adopt a healthy balanced diet, exercise regularly, and stop smoking to manage their symptoms effectively and slow down the progression of the disease. Myth number 8 is miracle cures can make arthritis disappear. Arthritis affects millions of people worldwide, and so naturally, along with scientific medicinal treatments, there are a lot of social, cultural, Ayurvedic, homeopathic, and spiritual practices that offer cure to this condition. For example, some people with arthritis believe that copper or magnetic bracelets ease their symptoms. However, there is no scientific evidence to prove this observation. Myth number 9 is that certain foods help or hinder the arthritis. There are a lot of claims that certain foods like tomatoes can cause arthritis flare-ups, and there are other foodstuffs like cider vinegar which can help in it. While there is no good evidence that suggests that there are certain foods that you should avoid or take more of, if you do find things that are helpful or make your symptoms worse, then listen to your body. There are definitely foods that have anti-inflammatory properties, immunity-boosting properties, and have very good effect on bone health. Therefore, a well-balanced diet will ensure overall well-being of the individual. Myth number 10 is a common misconception that arthritis is rheumatoid arthritis only. In many cultures, any joint-related issue is called rheumatism. This is a loose term and can cause unnecessary fear among the people. Rheumatoid arthritis is one of the many types of arthritis and is very different from other types of arthritis. Did you believe in any of these myths, or do you have any other fact or a myth to share with us? Please let us know in the comments section below. Until then, stay happy and stay healthy, and stay tuned for more simple and straightforward health guidance to help you with your healthy aging.